Every Thursday, let's get skin to it with dermatologist Dr. Sandy Skotnicki and personal stylist and beauty enthusiast Marlo Sutton for a new episode of Skin to It, where we guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Skin to It, a podcast brought to you by Bioderma.
Welcome to Skin to It, your guide to healthy skin, where skincare meets laughter and beauty blends with banter.
I am Dr. Sandy Skotnicki, board certified dermatologist, and I'm here with my good friend,
Marlo Sutton.
who is an amazing stylist and beauty enthusiast. Today's episode is all about needling your skin.
Yes,
What does that mean? So
I know firsthand.
yes, she knows firsthand. So what we're going to do is we do with all of our podcasts is we're going to define what microneedling is, give a bit of history, and then Marlo actually went for microneedling, so we're going to talk about her experience.
I'm going to say best day ever.
Best, yeah.
You know what's great about having a friend who's a dermatologist is that,
many things.
well, amongst other things, is that Sandy can really look at my skin and say to me, this is the procedure that's going to really be great for you. And I mean, any dermatologist, once you meet the right person, will be able to let you know what you really can is going to make a big difference in your skin.
Yeah, they're not trying to upsell you. They're there to give you what you need. So let's define microneedling. Microneedling. So one of the fun things for me, because I know a lot, but when I wrote my book, and had put pen to paper, I was like, is this actually still true? Or do I actually really know everything that I think I know?
It's evolving quickly, right?
Well, and you don't always get into the science or the history. Like I know the rudimentary science, but microneedling's actually been around for thousands of years. We go back to ancient China. I mean, the acupuncture using needles
Right.
to release qi, to unblock.
Okay.
And then in Germany in 1905, it was used. It was really first. That was the first evidence in the history that I could find about using it for scars. Because when you needle the skin, you're actually removing skin and you're forcing it to regrow. So it really had its first use in scarring. And in Canada,
It sounds so scary, but really,
no. Well, when I talk about how it works, I'm going to use an analogy that really makes sense because think about putting needles on the skin, but it does actually really make sense. And then
and having done it, it really wasn't scary. Sorry.
it wasn't that scary.
No.
And then in Canada, really played a role. A plastic surgeon, Andre Camarand. You want to say it in French?
Camille.
He was a plastic surgeon that really, again, started to, it was 1996, and he published some articles about using micro needling or injuring the skin to actually help scars. So, yeah.
Okay, so sorry, I already have some questions.
Right.
So there's one use of it so if you have scars to reduce the look of scars.
So let's talk about how it works. Okay. So I always use the analogy with my patients. I actually use a gardening analogy.
Okay.
Aerating the lawn. Do you know what aerating the lawn is?
I do.
Okay. If for those listeners who've never done that,
I mean, I've never done it.
right, but you know what it is. So think of your skin like the lawn. So it's got the top part, right? All the fluffy stuff. That's your epidermis. And then the deep part is the roots.
Okay.
That's the roots of the grass. That's the part of your skin, the dermis, right? Where you have collagen, elastin, your hair bulbs, and nerves, everything. So
Cool.
when you remove a hole, like when you aerate the lawn, you put a hole in it, you're actually forcing that grass to regrow from the roots. And you get new, fresh grass that's more soft, it's new,
Right.
and it's abundant. So you're doing the same thing to your skin. And the depth is very important because the at-home units, you're just doing the surface of the skin. So you're not really getting a lot of that fresh new skin.
Like deeper in there.
Deeper, yeah.
As soon I told my mom I was going for microneedling, and the first thing she's like, "Oh yeah, I bought one of those tools to do it for myself at home." And I'm guessing
they go very, very. They go 0.25. So let's actually digress and talk about the depth, how thick the skin is. So average skin, most parts of the face is like 3 millimeters, 3.5 millimeters, and the hair bulb is sitting around 2.5, 3.
Okay.
So the at-home units are going to 0.25.
Okay.
So you're not really producing a lot of injury. Like, again, we go back to that analogy of aerating the lawn. You need to get down to the roots.
So
To really,
how deep are we getting with
well, I mean, the systems that you go, like the one I have in my office, we have it. The great thing about this device that we have, it's called the DermaPen, is it's an adjustable. I can adjust the technician can adjust to go from 0.25 all the way to 3.
Okay.
So most of the time we're at like 1. You probably would have. She went easy on you, so
Yeah.
you probably had maybe 0.5. But the deeper you go, the more results you get because you're
Okay.
injuring the skin more.
Right.
Yep.
Okay. So can you tell me what, like, who are you recommending microneedling for?
Right.
Who's the best candidate?
Well, let's talk about what microneedling can help. So, again, think about it. I really like to explain it to patients. If you explain how it's working, like a light bulb sometimes goes off, you go, oh,
Right.
okay, that makes sense. So, if you have a lot of brown and you put a bunch of holes into the brown, wouldn't you think that would help? Yes, of course.
Okay.
So browning of the skin, like melasma, which is the sort of brown on the cheeks, lentigo, or those liver spots, which is not a medical term, but the brown spots from
Okay.
sun damage. If you that is a collection of what we call pigment,
Melasma.
melanin
Melanins,
in the
right?
skin,
Yeah.
in the dermis,
I'm
right?
learning. I'm learning.
So if you put holes into that, you're breaking up the pigment
Okay.
and you're kind of reducing the pigment. So it's really great for people that have hyperpigmentation of the skin, right? In particular, melasma, and it's really good for patients of color, because lasers are challenging, and we'll get to that on the laser episode for people that have color because they have heat associated with them, and when you heat or when you have hot. Like the laser heat can actually cause increased pigmentation in
Okay.
patients of color.
I didn't
So
realize that.
microneedling is really great for pigmentation and in particular for patients of color.
Okay.
Fine lines and wrinkles. I mean,
Yeah.
a fine line and a wrinkle is the loss of collagen and elastin in that dermis. So you're poking a hole in it and you're forcing new collagen and elastin to grow.
Well, I have to say what's interesting is right after I did it, I took a video of myself. And because I was like, wow, okay, I don't think my skin will ever look this good.
Yep.
But Anna, the technician, said to me, she said, you'll get the full result in about a week.
Right.
And that was so
Well,
true.
think about again the aerating of the lawn. You put a hole in the lawn, it doesn't look good right away.
Right.
It has to grow in. And
Yeah.
then a couple of weeks later, like, wow, the lawn has doubled in thickness.
I know it was really
Yeah.
wild.
And
Really, really wild.
so wrinkles, especially wrinkles like around the eyes, around the mouth that are kind of harder to treat with other things.
Mhm.
And there are some microneedling devices that have radio frequency, which is basically just think it's a needle that is also delivering a heat. So you're injuring the skin even more.
Right.
So you're not just putting a hole in, you're actually injuring the skin around the hole.
Yeah.
So the more injury sounds counterintuitive, but the more results.
Right. And Sandy asked me to record myself having the
Yes.
procedure. It's not really procedure. The treatment.
Hmm.
Do we call it treatment? Having the treatment, and you could tell I'm like I'm a little bit anxious at the beginning. It's kind of funny to hear it, but it really was painless,
Yeah,
actually.
we're gonna listen to your recording.
Yeah.
So we've got skin pigmentation, wrinkles and fine lines. It can help with pore size. So okay, so a pore is actually an opening where you have a hair follicle.
Right.
So if the pore, I think of, again, I like analogies. Pore is like a pothole in the road,
Okay.
right? So it's a hole. And if the hole is too big, the only way to repair it is to actually damage it. Like you got to put holes through it, which again seems
Kind of
counterintuitive.
counterintuitive.
And
Yeah.
and when it regrows, it's tighter.
Okay.
So it really works for when people have large pores around the nose, mid face, chin area. And then it's really great for scarring. So if you think about a scar again from the basic science or the scientific thing, if you skin your knee,
Mhm.
the skin grows back, no scar, because you're only taking off the top layer of the skin, the epidermis.
Okay.
We get a new epidermis every 30 days.
Oh,
But if you skin your knee and you get down to the dermis, where you have collagen and elastin, you only get one dermis. It doesn't
bro.
regrow. So if you put holes into that dermis,
Mhm.
you have a scar in there, you have scar tissue. Scar tissue is just really thick collagen, too much collagen. Then you
I'm thinking around too much information. But anyway,
yeah.
yes.
So you put holes into that deep dermis where the scar is, and you force new skin to come so it softens the scar. We
Okay.
can soften the edges, we can soften the thickness, and you got to have a device that goes at least to 2 to 3 millimeters. And
Okay.
you're not going to
Interesting.
get that with a home unit.
Right. Yeah, I totally understand that. Because I sort of always thought that you used lasers to treat scars.
Okay, so microneedling, I say that so the laser that treats scar is a fractionated laser that we'll get to on the laser episode,
Yeah.
which is also putting holes into the skin.
Okay.
But so laser is microneedling on steroids.
Oh,
So
okay.
you're getting more holes, thousands of holes rather than hundreds of holes. You can really dial the depth very, very accurately because the laser head is like a computer head.
Okay.
And you also have a heat source, right?
Right.
So you've got either an erbium laser, which is, or a CO2 laser, which is you're putting the hole in, plus you're damaging the skin. And then the last thing is photo damage. So people that have a lot of sun damage, which is wrinkles or brown and all the rest of it, microneedling is great for.
Okay, I love that. So when I did the microneedling, and I said, okay, next time you come and do that, we could do like the vampire facial. So
Mhm.
we can use your plasma, we can apply it. So the PRP.
Right.
So that's what PRP is?
Okay, so the next sort of iteration of microneedling is so you got holes, you're putting holes into the skin.
Yeah.
So let's go back to the lawn
Lawn
analogy, a gardening
analogy.
analogy. You put holes into the lawn,
Uh-huh.
then you put fertilizer.
Right.
So you're putting all this fertilizer over all these holes. So you're not only removing it, but then you're getting it all this good stuff to make it even grow bigger. So you can put stuff over the microneedling holes.
Okay.
One of the things we do is we put hyaluronic acid.
That's what she did.
Yeah,
Yeah.
you can put vitamin C, you can put peptides. You don't want to do any retinoids or anything like 'cause those are irritating. And then you can do PRP. So PRP, let's define what PRP is. Plasma rich protein.
Oh, I didn't even know that.
Yeah. So you take someone's blood,
Yeah.
you put it into a centrifuge, it
Mhm.
spins, and you take
That
away the cellular component and you're left with the plasma. So again, here's an analogy. I'm all about
She's
analogies.
all analogies
Yeah.
today.
So if you sprain your ankle,
Mhm.
the swelling is plasma.
Oh, okay.
So it's your body's way of healing itself.
Okay.
So PRP has been around for a long time. From somebody tears their hamstring,
Yeah.
you can put in
Sure.
plasma into that.
Actually, a friend of mine
Yeah,
tore her
yeah,
hamstring, and that's what she
that's
was
what we do.
doing.
Or your
Yep.
Achilles tendon. Tendon's a little bit harder because there's not much blood there. It is used for osteoarthritis when the cartilage is decreased. It's not as helpful for that, but it can buy people time before they have a replacement for a knee or hips more knee. So you can put the plasma over top of the holes, and the plasma is full of growth hormones. So there's a lot of growth hormones that will stimulate collagen production, fibroblasts, which is this is cell that makes collagen.
Okay.
And one of the biggest applications of microneedling and PRP is in hair growth.
Great.
So we'll talk a little bit about that, but
Oh, we have a whole episode on hair,
hair loss. But
and I can't wait.
yes, but the growth aspects of the plasma for your hair is something called a vascular epidermal growth factor, which so you're going to increase the blood supply
Right?
in the so the plasma, the PRP has things in it that are going to increase blood supply to the hair follicle.
Right.
And then it also has growth factors that stimulate the hair bulb. And there's lots of, and okay, we
So
talked
how
about,
long has PRP been around?
I actually don't know that. It's been around for a while. There's some controversy around it because it's not necessarily regulated. It can't be done by a non-medical person. It
Okay.
has to be a doctor or a nurse, somebody, it has to be at a medical facility.
Okay.
And
Should be at a minute.
yeah, because it's blood product, right?
Right.
And there are some contraindications, if you have a blood disease or you have low platelets, if you have if you've had a history of blood cancer or bone
Okay.
cancer.
Wow.
So there are some contraindications. And this is the trendy name out there is vampire facial because
Right.
it's like, it's not really blood.
No,
So there's no redness because you're removing the
you're
cells.
removing the cells. So
Yeah.
it's like a white almost,
Yeah,
isn't it?
it's a clear, it looks like pee.
Well, there you go.
It's just yellow. It's a yellow liquid. Yeah.
So we're getting back to this, and we'll talk more again. You said about the lasers, which we have a whole episode about. But so you
I
go
want
to
to
your
get into your episode. I want to get into
into
your
my
procedure.
well, first of all, it would like we are going to get into it, and you can hear me talking through it, and you can hear my surprised voice as you've started. I almost was like, "Oh, you've started." I didn't even hardly
Okay, I
felt
don't think the
that.
listeners know. So Marlo went to my office and she was a guinea pig. She called herself, she got a free treatment.
Oh
And
my
she
gosh.
she had a micro needling
I
procedure.
appreciated the free treatment.
I'm
Trust me,
just
it
teasing
looks
you.
really good.
And so let's go through let's bring up the first little bit of your visit.
So I'm here today. I'm getting microneedling with Anna. I'm very excited. So the first step is that I'm like skin is clean, no makeup, and Anna's about to apply a numbing cream. So what is this numbing cream?
So this is a very strong topical numbing cream that we normally apply to just prep the skin before we microneedle, um, take the discomfort away.
Okay, great. So how long will this take to
About
numb me?
10 minutes.
Okay, great. And maybe just while I'm waiting to get numb, do you want to tell me what this is going to do to my skin?
So what microneedling does, it helps to regenerate new skin to form. So it's great for softening any fine lines and wrinkles. It will help improve the texture and overall appearance of the skin. And I really like the fact that I see really nice improvement with pores. So anybody that has large pores, it'll definitely help minimize the
Amazing.
pores. Yeah.
Amazing. Okay. So I am going to sit here for about 10 minutes and get nice and numb.
Okay, so Marlo, basically, you had some numbing. She prepped your skin. So
Yep.
let's talk a little about that. So the numbing we use in most dermatology offices is a combination of a mixture of topical anesthetics, lidocaine, and other things. Amla is like the drugstore variety. We have like it's a slightly higher concentration,
yeah.
and the onset is much quicker. But for any of the listeners who are going, "Oh my God, I couldn't have somebody put holes in my skin," you should never be concerned about pain when you're having a procedure because there are various options. We have laughing gas. You can laugh away and have your microneedling.
Next time.
Yeah, we have something called Penthrox, which is a analgesic, not an anesthetic. So analgesia just decreases your pain from like 10 to 2.
Okay.
And it looks like a vape stick.
Oh,
And
cool.
yeah, it's very cool.
Okay.
So you don't have to ever worry about pain. And if where you're going doesn't have those options, then go to a different place that has those options if you're scared about the pain. And so it's also very important to prep the skin and disinfect the skin because you're
Yeah.
putting holes in the skin.
Is it?
And the device that we use in our office and most offices will have a disposable sterile tip, which is very important. And it's an automatic injector. I don't really like the rolling things because they damage the skin a bit more. They come at an angle.
Okay.
So the device we have is a rapid. You would have remembered
Yeah.
it's rapid.
Yeah.
You'll hear it in
Like
the
I
next
honestly
audio.
did. Yeah, you'll hear it in the audio, but I really barely felt it.
I think part of it was she didn't go that deep on you.
Because I didn't need it, Sandy. I didn't
No,
need
you
it.
have glowing skin area. Okay, so we're gonna listen to the next part of Marlo's microneedling adventure.
Okay, so I am all numb. Anna is just removing the excess numbing cream, and she's going to explain exactly the tool she's going to use to do the microneedling on my face.
Okay, so I'm going to be using the DP4 microneedle pen. It is FDA Health Canada approved. Helps to treat scars, improve any textural issues, great for anti-aging purposes.
Great. And you said it's like little needles. So you're basically piercing
Right.
my skin. The tool will pierce my skin with little
Yeah.
needles.
Yes.
And this will stimulate the collagen and the skin will sort of, I guess, repair itself. Okay, so where are we going to start?
So we're going to start forehead first. I'm going to do 1,000 passes on each section of the face.
All right. So what's happening here, Marlo? What did you think? So you said it didn't hurt very much.
No, really, not at all. Not at all. And I mean, that's a good thing. You want to be able to talk to your technician. And
Mm-hmm.
she understood like I was a little bit anxious because I had never done it before. But as soon as she started, I could tell I was going to be fine. It was really painless.
So what she was doing is she put a layer of hyaluronic acid on first. So remember we were
Yeah.
talking about the gardening analogy.
Gardening.
So your hyaluronic acid is kind of like the fertilizer over the
fertilizer.
holes.
And
And
I
it
thought it was nice and cool, actually.
it didn't say hyaluronic acid is a moisturizer in essence, right? But she could have put peptides or vitamin C or the PRP over top.
Right.
And so you usually start the forehead and you go down, and you can actually, the apparatus again I have, you can change the depth that the needle goes,
Right.
because it's more, you don't need to go as deep on the forehead. You might want
You
to go a
want to go
little deeper
deeper
around the
areas.
eyes,
Right.
around the mouth where you have more lines. If you had some pigments, you might have dialed it up a bit.
Okay.
So it's awesome that you can do that.
So Anna was just telling me I'm going to avoid any activity like where I was like sweat for the next, 24 hours? About 24 hours. That's
Right.
great. And then just in terms of putting makeup on.
You can wear makeup as long as it's gentle enough. I would say just keep the skin moisturized, and especially for the next week, it will be a little dry.
Perfect, right?
All right. So, yeah, so you've had the procedure, and I think you had a first little glimpse at yourself, didn't you?
Okay. You know, Anna gave me a mirror right away so I could just see my skin, and it really truly was glowing. I guess your skin's like a little bit sort of like you're a little bit kind of
Wait,
puffy.
you damage your skin.
Yeah.
You're damaging it.
Yeah. But I was flushed, but definitely no red. I had no little pinpricks. I had really nothing. My skin almost looked like glass.
Right. Yeah.
It was crazy.
Okay, we are just finishing up. We're doing a little bit on the neck. And Anna's kind of going over in the spot she feels needs a little bit more attention. Feeling pretty good. I'm going to look in the mirror in a couple of minutes and just see how it all looks. Okay, so I'm done the treatment. My skin looks incredible. I mean, if I say so myself. It's a tiny bit red, a little flushed. And then Anna's going to apply cream that will peel my skin, nice thick layer. And I will be using that for the next couple of days, just while it all heals up.
All right. So essentially, pretty easy. Pretty not too bad.
Easy, worth it. Well, worth it because it was free. Sorry. No, easy, painless, amazing results that have kept on giving, and pretty easy aftercare. I used like a really great
Anna usually gives the Bioderma
Yeah.
Seco-Bio, right?
Seco-Bio, which is like this really wonderful, rich cream from Bioderma.
So Cica is a very interesting ingredient. It's Madagascaricide is the ingredient name, and it comes from a plant, I can't remember it. And there's a lot of studies that it helps injured skin heal faster.
Yeah.
So yeah, Cica, you'll see Cica in various other brands, but we use the Bioderma one in my office.
Yeah, and she put some on right away, and it felt great. And
Yeah.
then I had
Feeling.
some at home, so I just used that for a few days after. It was a very, very fast recovery, no downtime.
Right. So that's one of the nice things about microneedling. And it also, you had a not as deep,
Aggressive. She
right?
keeps saying that.
Which,
You're a wimp.
yeah, you can do it again and we'll go a little deeper. But so what is the aftercare? How often do you need to do it? The aftercare is, I mean, you have holes in your face, so you don't want to be, slothing on like tons of makeup. Or
Right.
you certainly don't want to use anything that's damaging like retin-A, glycolic acid. You should protect yourself from the sun and use sort of healing kind of Cica type moisturizers that are going to increase the healing.
Yeah.
And even just straight up hyaluronic acid. So how often do you do it? I kind of like to do it quarterly.
Okay.
I don't have the time. I can't take downtime. I'm all too busy. So I like it that there's not a lot of downtime.
No.
In one treatment, you might remove, I don't know, maybe 8% of your skin.
Wow.
Okay. And with fractionated laser, you're removing more skin. So to get a mass effect, a really visual long-term effect, like producing new dermis, you have to do quite a few treatments.
Right.
And so that's the one way of looking at it. Like, how many holes do you need to actually produce like 50% new skin? That's quite a few treatments.
For sure.
And you can also look at it as maintenance. And it depends on whether you're doing it for scarring or
Do you
pigmentation.
think that the in between doing the home microneedling?
Yeah, the home one I find challenging because it doesn't really go very deep. I mean, it's better than many things out there, like snail oil or whatever. I mean, so snail mucin or
Thanks
whatever.
for that.
Yeah. No, I mean, I think, and also some of the microneedling is helpful to deliver serums to the hair, like when we have topical finasteride or things like that. We'll get into that.
Oh, we will get into that.
Yeah. I think microneedling as a general concept is good.
Yeah. Well, listen, I'm a believer. I'm
You're
a believer. I'm into it. I'll do it again. Sandy will tell me when, and I will be at her office. To do it.
I think we killed microneedling. If you have any questions, one of the great things I was listening to another podcast is for this series, we're not necessarily taking listener questions, but we both are very active on social media,
For sure.
and you can DM us if you have a specific question, or you have a guest you'd like us to have, or you have a question about an episode, and we'll endeavor to get back to you that way. So thank you so much.
Thank you. And I appreciate it. I loved my microneedling session.
We'll see you next time on Skin to It. Catch us every Thursday for a fresh exclusive dose of Skin to It. And don't forget to subscribe so you never miss out on the skincare wisdom. We will guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Loving our podcast? Share your thoughts and help us grow by leaving a review on Spotify and Apple Podcasts. Until we meet again, see you soon on Skin to It, your guide to healthy skin. Skin to It, a podcast brought to you by Bioderma.